Dr. Twinkle Gupta.
A very good morning to one and all present here. I am Dr. Twinkle Gupta from GGS-MCH, and I will be presenting my paper on awareness about incidents about body fluid splash injuries to eye and protective eyewear practices in healthcare workers. So healthcare workers are at an elevated risk of exposure to life-threatening infections like HIV, HBV, and HCV. While hand hygiene and PPE are always in the limelight, eye protection always takes a back seat. So our aims and objectives include to assess the awareness of doctors about the risk of blood-borne pathogen transmission through eye splash injuries. Secondly, to assess the knowledge and protective eyewear and identify the barriers in their use. So we made a 29 MCQ questionnaire with a lot of visual cues, and we distributed it through online survey, through WhatsApp, and printed, which we distributed in the OPDs. So in our study tool, the 29 questions were divided into 4 categories: demographic details about medical specialty and years of experience, incident history about history of blood splash injury, procedure it was done, and viral markers of the patient, awareness about blood-borne pathogen transmission, universal precaution and use of PPE glasses, along with safety precautions about steps after blood splash injury, and facts about protective glasses. So, total 137 participants were included in the study, out of which 35% had a history of blood splash injury, out of which a staggering 6.3% had a history of incidents of blood splash injury, which are HIV, HBV, or HCV positive patient. So in our demographic details, maximum of the doctors included had less than 10 years of experience, maximum were from ophthalmology, followed by pathology and ENT. 71% of incidents were seen during emergency surgeries. These surgeries were generally less than 1 hour. The most common procedure experiencing such incidents was C-section, followed by emergency suturing. So about awareness, the third section. 46% of the doctors did not know that 1/3 of Hep C exposures are through mucocutaneous routes. 27% were unaware that there have been documented cases of HIV and Hep C transmission through conjunctival blood splash injury. Majority were unaware that there is a 45% incidence of blood splash injury to eye even while wearing protective glasses. 48.9% did not know that even wearing prescription glasses does not eliminate the risk of blood splash injury to eye. So precautions. 41% said that they routinely wear eyewear, but the rest who did not, they cited a few reasons, out of which the most common one was fogging, followed by discomfort, and third one, routine unavailability. So at the end of the survey, we had, after telling the doctors about the awareness and the PPEs, we asked them, are they willing to wear the protective glasses now? We saw a staggering increase. Initially, there were 41% who were willing to wear. After the survey, there were 72% doctors who were willing to wear. So a 31.2% increase was seen after only a survey. The salient features of this study was we could assess the impact by documenting a 32% increase. Similar studies have been done by Chong et al., where out of 71 participants, 22% had experience of blood splash injuries. Davies et al. Had 384 operations, out of which 45% had such incidences. And Olabisi et al. Did 144 cases of C-section, out of which 63% had blood splash injuries on the surgeon goggles, and 38% had blood splash injuries on the assistant goggles. So the strengths of my study, it's a mixed approach study. So we went for OPD and WhatsApp. Survey addressed knowledge, behavior, and barriers. Impact was assessed at the end of the survey. The limitation was it was a smaller sample size, hence limited generalizability. And self-reported data was seen, hence there was a major recall bias. Future direction, we can target some educational programs regarding the same and collaborate with healthcare facilities to ensure there is availability and accessibility. Hence, there is a need to increase the awareness and compliance with protective eyewear for healthcare workers to reduce the transmission of blood-borne pathogens through eye splash injuries. Thank you.
Any segregation of this department-wise? Suppose you took 100.
Yes, sir. I have, sir.
Yeah. And out of that, 70 were from gynae department. So how that could have influenced your study?
Yes, sir, 100% it could have been. So even there were 2 problems in this. First, I only knew doctors who had less than 10 years of experience. And second, maximum people I knew were from ophthalmology and ENT. But in the studies, it has been reported that there is a higher incidence in vascular surgeries and C-sections.
That's
So
right.
that could, we
But-
need a bigger
but-
sample size for that.
But of course, specialty of the
Yes, sir.
participant did matter.
Yes, sir.
And have you ever yourself encountered such?
Yes, sir,
kind
multiple, sir. That's why I did this, sir. So there was 1 month in which there was a ENT HOD, sir. One of my co-residents who had a blood splash injury with a HIV patient. So she had to be on ART for 1 month, after which I had started.
So what is the immediate treatment?
So a wash, 1 to 2 liter NS RL wash.
Is it simple tap wash or some kind of the other tap is there?
So we generally use the RL bottle, we put it on the IV stand, put IV line, and we just put a kidney tray and do the wash.
Go what the NABH recommends for
Okay.
that. There is a special tap, there is a container, and the pressure comes with 2 tap, and
Okay,
you have to wash it there only with the pressure.
Okay, sir.
Go and read in NABH.
Okay, sir. Thank you, sir.
What is the incidence of these viral infections, HIV, hepatitis B or HCV after splash of
Sir,
blood and body fluids?
so there's not such incidents, but there have been documented cases. There is no study which is saying this is the incidence of HIV through blood splash injuries, but I have seen there were 2 documented cases of one of HIV and one of HCV.
You mean there is no published literature on this? I don't believe this.
So when
There must be.
There is.
So when
lot of-
I had
Have you done review of literature?
yes, sir, yes, sir. So when
So if you are not aware of the incidence, then what makes you say that it is because of the this thing contact with mucocutaneous? Normally it is the prick, small needle prick injuries which lead to accidental needle prick injuries during surgery.
So all the point that had said that 1/3 of Hep C exposure are through mucocutaneous. So I've taken references for all of these. I've taken them from proper studies, sir.
From published.
Yes,
That means
sir.
there has to be incidence.
Yes, sir. Yes. So,
If
but
it is
there is
report-
not, sir. There's not specific or only blood splash
You
to
did.
conjunctiva.
I don't think you
couldn't
did
find-
review of literature properly.
Maybe,
Incidence
sir.
has to be there.
Maybe, sir.
Okay.
Yes, sir.